Real women.
Real talk.
Real messy.
This is Messy Midlife. Hi, everybody, and welcome back to Messy Midlife. Hi, ladies.
Good morning.
How's everybody doing today?
Slightly brain dead, but trucking along.
Life is moving really quickly right now, and it's feeling whirly all around me.
What parts of life?
Oh gosh.
Everything.
Yeah, the sandwich generation aspect of my life is really on fire right now. The protein in the middle feels really good. My marriage feels really good and stable and supportive and really helpful, but the parent management and health concerns is really complicated right now. And my son is going on this, Colorado does this camping trip kind of where sixth graders will go for 4 days to a local a mountain. And it's exciting. It's big, lots of emotions on all aspects of it for him. And so it's a lovely thing. It's just taking up a lot. And the other thing is less lovely and it's taking up a lot. And so I'm feeling the squish
Yeah.
today.
I've been wondering what's going on because you've been more quiet than normal, and you're not somebody who tends to be quiet when you're doing
Ever?
well, or even if you're just struggling a little bit, you don't tend to be quiet. When you get quiet, that's when I'm starting to worry more about what's going on with you.
The quiet is a new thing, I think,
Mhm.
actually, in
Hmm.
midlife for me. Yeah, I've always worked everything out verbally, and I'm finding so much strength and groundedness within myself, which I guess is something to celebrate.
Yeah.
I think so.
As long as it still feels healthy, that it's not a quiet because you are feeling any number of the things that are not really helping you to move forward with what you need to do. Yeah. I am dying to hear what your husband thinks about being called the protein in the middle.
Well, that's a new development as well. Just came to mind.
It's a
I'll share.
compliment.
I'll share and get back. I think you will probably appreciate that. Yeah.
I like the quiet, Karen, and I think that there's a lot to it and like having that stillness of just letting yourself process it and not always having to be verbalizing it and talking about it and talking through it. I think what I've noticed, I think for all of us is we've gotten a lot of clarity like in our quiet and in our stillness lately. I know I have. I see it in Jen also, and I think I've seen it in you too, especially with holidays and family dynamics and all of that. So I think it's good for us to have that time of just being still and not feeling like we have to figure out every part of it.
You've seen clarity and quiet for me?
Usually you would bring up like going into a surgery, right? And you'd have all these reasons and you'd bullet point, bullet point, bullet point, right? We'd get this really long text and you were like, yep, having the surgery, feeling really good about it, 100% clear on it. Like, I think that you were able to process that internally really well.
No, I process it with my therapist
Well, there you
and
go.
my surgeon. But yeah, I think I had a month to spin on it and I just got tired of spinning. I got a little dizzy from it.
Yeah.
And I did have to get to the point that I settled in to just feeling a lot of gratitude that I have a doctor and surgeon that I trust and that who has not led me astray ever. And she has been really important in a lot of ways in my life. She is the first she helped me through my fertility challenges that I had when I had a couple of miscarriages. She did a workup that went above and beyond what I expected, especially through the VA, because I get my healthcare through the VA, as you guys know. So I didn't expect fertility to be something really emphasized at all. And it was. I don't know how far it goes beyond just the very basic workup for is your body doing what it needs to do to be able to produce a child. Because I was not interested in doing IVF. But so she was there. She helped me with the workup. She was the first person that saw my daughter's heartbeat to confirm that she was alive and she was in the right place in my body, and then sent me off to somebody else to handle it because the VA does not deliver babies. And then when I had my emergency room visit that I showed up in an ambulance for endometriosis that you should never have an ambulance ride for without knowing you already have it, right? How many people end up in an ambulance because of endometriosis? And we could do an entire episode all about my endometriosis experience, and maybe we should. But she came to the emergency room when she was on call. She showed up in sparkly flip-flops and a floofy skirt on a weekend to see me in the emergency room, and then came to see me in my hospital room that I was in before I was discharged to just check in on me. It's not the location that she typically practices at, but I do believe she does surgeries on Mondays, so it was probably a convenience thing, and she still did, because not how many people are just gonna show up and check in on that. So, and I'd been in the emergency room for what turns out was endometriosis, but I wasn't sure if it was endometriosis or appendicitis the month prior. And that attending gynecologist didn't come in to see me and then just put me on hormones. Anyway, I'm getting off track. But put me back into the emergency room, probably because she was trying to say, hey, I'm not the right one for you. Let's get you to this other doctor. So we got to put you in the emergency room for this other doctor to be back in your orbit. Anyway, I did finally reach the point that I just had to accept that I didn't have an answer and I was not going to have a guarantee for my answer for what was going to happen with the surgery, and that I just needed to lean into somebody who had seen it, because you can't see endometriosis unless it's on your ovary as a cyst, an endometrioma. It's the only way you can see it, which is BS, that we still haven't figured out a way to find endometriosis that doesn't involve surgery. Right? But she's at least seen it. She's got a more she's dealt with more endometriosis than I have, so I finally just got to the place that I was like, I can't make this decision with any sort of guarantee. I just need to lean into her and trusting her. And we processed it in the visit, and that's the other thing, because she was like, we don't need it. It's not an emergency. We don't have to like get this done now, but I think we're heading there anyway. And then we talked through the pros and cons, which I just shared the pros and cons. Like I was like, here's what we decided, here's why. I think that weirdly, surgery has the greatest likelihood of having the biggest benefit with the lowest risk big picture for my health as a whole. And so surgery just is the place to go. So I'm having surgery. There's my announcement. Having surgery again. And it's funny because after I remember, Eliza, you brought me home from my first abdominal surgery. And I said, I'm never having abdominal surgery again. And now I'm having my third abdominal surgery. So hopefully this will be my last one.
It's
Hopefully.
the right thing for you
It is.
to not have to keep having abdominal surgeries.
Hopefully. Hopefully. There's no guarantee, but hopefully. And I did have to get to a place of acceptance. You guys have been so proud though. My last therapy session I had, I was like, my therapist basically said, we do a virtual visit. And she said, if we had reactions available to us in this platform, I would have been doing all sorts of like applause and celebratory things, because she said, I wish I could record some of these things and just hand them to you so that you can hear yourself and the skill you're using in these conversations with your dad, in these conversations with your husband, in the way you're navigating this challenging thing, the acceptance that you just demonstrated on this thing that, yeah, you don't want to have, but you do. And you just have to choose from the options for how to navigate this and what makes the most sense and what connects most with your values. So it was a proud moment
Yeah.
for, I think, both of us.
Can't
Like,
talk.
I feel like that is happening a lot for me as well. And I wanted to make sure that I shared that I so appreciate what we're doing because, and I don't know, maybe Jen, that would have happened regardless of our podcast meetings. But I know for me, the accountability that we have here is really fueling my own healing and growth and evolution. And I wanted to thank you both for that. It makes, that's why we wanted to do it. And we hope that it touches other people as well. But it's
Yeah.
without a doubt having a tremendous impact on me and my healing.
Yeah.
I think it's so important to have that place to come on a consistent basis. And I know that obviously therapy is part of that for all of us, but I think there's a difference when you're talking to your friends. You guys know me on a level that my therapist doesn't. And I just think it's important to have that space to come and just spill whatever you need to spill and put everything out there and just be able to kind of work through it in real time. And I think that's what I'm finding with our podcast and recording is it's just giving all of us that space to do that, which I'm really appreciative.
And giving the people who are willing to give us their time and share, at least share in the conversation on a more receptive side. And we've gotten some feedback from people and had some requests for topics. So we're going to definitely tackle those topics. For anybody who is listening, if there's stuff that you would love for us to chat about that is really affecting your life, it's probably affecting ours and we just haven't gotten to it yet. So let us know and we can absolutely be more intentional with some of our topics as well. I do think that it is, at least in part, responsible for this peace that I have reached with this decision about my surgery. And when we were getting started, I wasn't necessarily planning on talking about this today. I was thinking more about rage, and maybe we'll do that for our next episode because we did end on a place sort of like disconnect, and I've been thinking about it and I want to come back to it. So don't let me forget to, to have us come back to that at some point. But perhaps it really is just the thing that we need to talk about today is the process that I had to go through and that you guys have had to go through as well for some different things. And maybe you're having to go through with your mom right now, Karen, with the health stuff, that walking that line of making a decision and not gaslighting yourself about a decision and how you would support somebody else in it versus yourself. And especially with something like endometriosis, but anything for that matter. What I can share, if you guys are interested in going down this path with me
I
right
think
now.
it's so important. I think it's so
Okay.
important because endometriosis specifically is one of those mystery illnesses that
Hmm.
where the medical profession has completely failed women in one of many ways, where I see so much suffering. And I love the idea of bringing more awareness to it through your process. So I love it. I'm here
Okay.
for it.
So we can go, if we're going to talk about the whole endometriosis thing today, we absolutely can. So I have apparently had endometriosis, likely had endometriosis for a very long time because the degree of adhesions and scarring that I had is not something that comes on within a few months. So I had what's considered grade 3 to 4, and 4 is the highest grade you can get for endometriosis. The only reason I was given grade 3 to 4 instead of outright 4 is because I had what's called wispy adhesions, not necessarily like really deep adhesions yet, but it was basically everything inside my my pelvis, my lower abdomen, and even up into my upper abdomen had endometriosis tying it all together.
Let's just
And so,
pause and maybe take a moment to define what endometriosis is. I think a lot of people are familiar with the term, but it's such a bizarre thing. It's such a unique female issue that it's interesting to describe exactly what it is.
we have the endometrium, which is the lining of our uterus that is supposed to be there, and it's part of what we shed every month when we have our period, right? And so the endometrial lining, when we have endometriosis, the endometrial lining is growing outside of the uterus. And so we have no idea in medicine how it happens. We have no idea what there's risk factors. We have basically no understanding of how it happens, why it happens, any ways to prevent it, or anything like that. No way to identify it. And we can get there in a minute too, except for surgery.
Exploratory
No,
surgery.
yes.
Just going in and
In
looking.
order to get diagnosed with endometriosis, in most cases, you have to have surgery to be diagnosed. Is there anything a man has that they have to have surgery to be diagnosed for? There might be something that I'm not thinking of, but any like strictly male thing that is requires surgery to get a diagnosis for.
And
I
this
don't know.
tissue can be anywhere, right? Like it can be in the nose, it could be anywhere in the body. It is so mysterious
It's
and
rare to
difficult
have it in
to
those
identify.
places, but it can. It's more usually like in the abdominal cavity. And I'm not an expert on endometriosis. Like I have decided I'm not the person that wants to necessarily dive in and learn and read everything and all of that because it's not a healthy thing for me to do. I recognize that there are some ways that being a doctor has really harmed my mental health because of the belief that I need to know everything and have the answer for everything. And I can't tell you guys how many times with all of the stuff I've gone through in the last year and a half since the endometriosis was discovered after an ambulance ride. I've been on a lot of medications for all the things with it and complications because it went from 0 to 10,000 overnight. And I can't tell you how many people have kindly, jokingly made comments about, I can't believe you're a naturopathic doctor and you have to be on all these medications. And I'm just like, oh, so I'm supposed to have all of the answers for everything, and my body is supposed to be perfect and not have any susceptibility to something. And I'm never supposed to have any issue come up that I need additional support for. Like, come on. All this to say, I'm not the world's expert on endometriosis, which is again why I leaned on my surgeon for the decision about surgery and treatment. So, growing and growing for a while, potentially related to the fertility challenges, though I don't think so. I think we ultimately figured out that there was not me, it was my husband. And maybe we should even talk about that at some point, that so much fertility is actually the guy. And it's how unfortunate, because my husband was proactive and he, without me asking him to, went and sought his own testing to just figure out if there was anything was going on with him. And I did my testing just to make sure I was doing my due diligence as well. But that's rare. It's usually, let's rule everything out with the woman first, and then we'll test the guy and see if they're swimmers or even swimming, or if there's even swimmers in the pond to begin with, right?
Not even like, let's rule everything out. It's like, let's just pin it on the woman.
Yeah.
Sometimes that's the case, you know? So it's possible that this was part of my fertility struggles, though nothing came up during that time. I did have endometriosis on my fallopian tubes, but my fallopian tubes were fine. Well, they did the histosalpingogram and they were open and there was nothing I found on them when we did that. And that was back in like 7 years ago that the
But what you're
HSG.
finding, what you have shared with us, Jen, is how prevalent this is, that we are thinking that the endometriosis is impacting so many other physical symptoms that you're
Oh, yeah.
having. So how could it not have, right? Whether it was central or not, how could it not have played a role in your
Yeah.
fertility journey?
So we only found out that I had endometriosis in spite of likely having had it for years. And we only found out about it because I went from relatively normal periods. No, I've never been somebody who's been like considered a heavy bleeder. Every once in a while, I would have a higher pain day, but and I have a higher pain tolerance, I think, than the average person. So I don't know if I did have a lot of pain and it's just was not as prominent to me. If we've talked about this before, if my military background leads to some amount of suppression, I don't know. But I never had anything that was notable about my periods until I had a random period where I got a fever and I had more pain than normal. I did have double over pain and it lasted about a day and a half. The most intense part of the pain was maybe it was like crushing W over pain. I have to go sit down. I can't even stand up with this. But then within 30 minutes or so, it was better. And it was just like a duller, but still very much in your face pain. But I had a fever and that was weird. And it was slightly localized to the lower right side. And I was doing self checks to see if it was appendicitis. And I was like, is this just coincidence? Am I having appendicitis at the same time that I'm having my period? Is this just the worst period I've ever had? I texted you, Eliza. Karen, I might have texted you. I definitely texted my friend Durga. And I was have you ever seen somebody have a fever with their period? And just back and forth and back and forth. This happened on a Sunday. Monday morning, I was still having a bit of a fever, still not feeling great. I just needed to go to the emergency room to make sure I wasn't missing appendicitis. And I didn't have appendicitis, but they did find a known cyst on my ovary. They found that I had really elevated white blood cells, which is not actually a common thing in endometriosis that's known, but actually a lot more common than you think if you look at some of the threads and discussion boards where I did at the very beginning, at least do a little bit of looking into things. So they had assumed, instead of seeing, oh, you've got an endometrioma, like nobody ever called it that for me. And then they said, you do have this cyst on your ovary. We think maybe there might be a superimposed infection on the cyst because my white blood cell count was substantially high and I had the fever. And so they gave me IV antibiotics and then sent me home with a 10-day course of antibiotics. They'd given me some painkillers in the hospital too, and then sent me home. And we're like, okay, great. The gynecologist that they had consulted with to just double check, because, emergency room physicians anywhere, but especially emergency room physicians at the VA, don't really know about women's emergencies, right? And so they had to call the gynecologist on call, and she did her check-in with me like a week later and said, "Oh, I see you happen to have a consult for gynecology in like August, and this happened in June." She said, "Do you want to just chat about it now to see if we can get that taken care of for you?" Fantastic. Great. And I was going to see the gynecologist because my primary care doctor was wanting to help me get a workup for perimenopause and possible supports for that because I was having a lot of changes in my body, in my mood, my attention, and my sex drive, lots of things that the more I was learning about perimenopause, because again, we weren't taught about perimenopause in med school, guys, right? So the more I'm learning about it through continuing education conferences and just conversations with people about perimenopause, I was like, okay, maybe this could all be perimenopause. And so she said, great, let's put you on hormone replacement therapy. And I did have some concerns about hormone replacement because there's breast cancer in my family on both sides. And this was after the reports were coming out from the Women's Health Initiative saying where we learned all of the Women's Health Initiative stuff was far overblown and that the reporting was so inaccurate because it told us that we had a 25% increased chance of cancer from using hormone replacement therapy, but it was 25% increased chance over the already low chance. So it was like taking us from a 2% chance to a 2.5% chance. And all of the ways that that reporting from that particular study had been so misleading for so long. But I was still concerned because I also have a couple of genetic variants that make me slightly more at risk for blood clots. And so I asked all these questions. She's like, no, 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 it'll be fine. Never once, because nobody's called it an endometrioma, nor do we learn a lot about endometriosis. Never once did I think I need to ask about this cyst and any issues with this cyst on my ovary that just sent me to the emergency room. Nor did she say, you have an endometrioma. Maybe we shouldn't be putting you on hormone replacement therapy. So I got started on it. And my next period, I went from feeling fine, went to Pilates, did a hard workout, driving home in the 10 minutes it takes for me to get from Pilates to my house. I started to feel like I was giving birth. It started low down. I was like, oh no, do I have a urinary tract infection? But it got so bad so quickly. My brain immediately went to, oh my God, is this interstitial cystitis? And which is a chronic inflammation of the bladder that can be an autoimmune thing. So I immediately went to a chronic thing. I don't know why, with like this acute, but it was just so intense. But I'm so good at suppressing. I've had 2 kidney infections because I can't feel a urinary tract infection. I don't catch it until it gets to my kidneys and I have a fever and horrible back pain and all sorts of things, right? So there's a pattern for me, definitely. But I get home and I cannot stand up. I am in so much pain. I feel like I'm going to vomit all over the place and I am not a puker. And I feel like I'm giving birth. And I gave birth with an induction for my labor and nothing else. So an induced labor, which tends to be more intense and faster moving. And by the time I was hurting enough that I couldn't tolerate it anymore, I was in transition, and so I could not get an epidural. I did ask for one because I hurt a lot, but I couldn't get an epidural because I reached the point where I couldn't sit still for it. And the fastest way to I actually gave birth about 5 minutes after the epidural would have started to have any effect because it was just intense. So I felt like that, but I was obviously not having a baby because I was definitely not pregnant. My husband took care of everything, so we did not have another child because I got a husband that's proactive. So good for him, right?
Good for you too.
right? Yes, for all of us. But like,
Uh,
he took care of the testing to have a baby, and then he took care of making sure we were done and did not have to be asked to do it. And so good job, Kyle.
Yeah.
If you ever happen to listen to this. So my husband, Kyle, who is not a shakable person at all, was very shaken because I was literally screaming and moaning like he had seen me in the delivery room when I gave birth to our daughter. So he called an ambulance. And of course, the whole time I'm like, no, 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 it's okay. Don't call an ambulance. I will be fine. This will pass. And meanwhile, I'm feeling like something is being shoved out of me. Like literally, I was like, do I have cancer? Is my body trying, like, what is happening? I don't know why I would go to all these chronic things. And it wasn't until I got to the emergency room and had enough medication in me from the ambulance that the pain was at least ratcheted down to like an 8 so I could think, that I was like, this feels like this might be endometriosis. And so I had already figured it out before I got into the emergency room. I got really lucky with a second emergency room visit because the emergency room triage doctor was like, do you have endometriosis? Because this sounds like endometriosis. And I was like, nope, nobody's ever told me I have it, but it sure does sound like it, doesn't it? So again, my white blood cells were even more elevated. So that's a thing to be on the lookout for. If you're having elevated white blood cells, platelets also very elevated. And that turns out these are things. Cortisol also, it was never checked in this time. It was checked at my request later. But these are all things that can be elevated in endometriosis that can be maybe potentially a sign for something if you aren't lucky enough to at least have glaring evidence that should have been mentioned to you or called the right thing from repeat ultrasounds.
I think it's also important that that is also those elevated white blood cells specifically are also why it is misdiagnosed a lot as appendicitis, as a urinary tract infection, because those are things that we typically would see with
Mhm.
a UTI or appendicitis. And so I think that's part of what makes it difficult is that's the first thing people go to, especially in the ER, right? The first thing people think of. And so it,
Right.
it almost like takes the focus away from the fact that this could be endometriosis. Because like you said, it's not as typical with it. It's definitely not something what the little that we do learn about it in medical school. I was never taught that you could have elevated white blood
No.
cells with endometriosis.
No.
Mhm.
But as sure as shit, we learned about appendicitis, right? So I think that's important for people to know too.
And I get that, well, maybe it's not that I even get this because they were so concerned about a possible superimposed infection on a cyst in my ovary, which is such like it's a possibility, but it's such a low likelihood possibility. Instead of saying, hey, maybe we need to actually get this cyst itself treated. Maybe this is the problem. They were just like, okay, as long as we take care of any infection, go on, you're okay. Right.
Exactly.
And so it was bad enough that I did get admitted just to make sure that there was nothing else going on. Got home and I said in the hospital, I said, I definitely want a surgery because I can't let this happen again. I can't have a 4-day hospital stay after an ambulance ride when I've got a little girl that I need to take care of. She was 4 at the time. And, a business and my patients that count on me and all of the things that I'm responsible for. So I said, absolutely, I want the surgery. And I got put on a medication to just stop it. So it was suppress my period and did help. So without having my period and having less fluctuations in my hormones, I did do better until my surgery. And surgery was about 3 months later. Got in there. Oh my gosh, it's everywhere. It was on my bladder. It was on my fallopian tubes. It was on my rectum, on my diaphragm, on my right ovary. And there was like just basically these wispy strands of endometrial lining like tying everything together in my pelvic cavity and my lower abdomen. Removed most of them, removed all of the wispy adhesions. There were 2 spots that my doctor ended up leaving because they're in tricky spots. Your diaphragm is a high risk spot, and the rectum also is a higher risk spot because if there's any issue with the surgical removal, you could end up having to have like a bowel resection, or if you puncture the diaphragm, you could end up with a collapsed lung, like that kind of thing. So higher risk. Weirdly enough, I had an appointment scheduled with my primary care doctor like a week later, and he had me go ahead and get labs because we were following up on a couple of things. And All of my labs got better within a week of surgery, except my platelets. Those were still, the platelets just take a little bit longer to calm down. And to be perfectly honest, my platelets have never completely gone back to normal. So, but inflammation, which should still be really freaking high after a surgery, was normal for the first time in months within a week of surgery, which just tells you how bad the endometriosis was, that how much that was driving inflammation, that I could be normal from getting it out, even though I am still in surgical recovery state.
And how systemic it is. I think
Mhm.
really appreciate that you're shedding light on this is not just a, pelvic issue. This is something that has been spreading like wildfire into your life, and it made it look even more mysterious.
Mhm. And so then so after surgery and after my all of this, my knee pain went away and other aches and pains went away. But then they started to build back up again. And okay, maybe it wasn't the endometriosis, maybe it was the rest that was helping me. My weight was blamed for a lot of things, including the high sensitivity CRP being elevated. My weight continues with the wrong provider to be blamed, even though sometimes when they'll look at the numbers and they'll say, "Oh, she just needs to lose weight. She needs to lose 20% of her body weight." I'm like, "Well, I haven't lost 20% of my body weight, but if you look, I weighed 15 pounds more when it was lower 3 months ago or whatever it is than I weigh right now, because I have actually randomly been losing weight, in part because I'm doing less, because I'm not driving inflammation. I'm not being as obsessive and controlling about things." And we talked about this on one of the past episodes just a little bit, but this was part of the discovery process. So the endometriosis surgery is not always fully resolving it, and that was my case. We had two small spots that were left, but it started, I don't know, something happened and it started to build again, and we don't know if was somebody that the medication was just not enough for and I continued to grow. We'll find out when we get in there. My doctor does not anticipate seeing any new lesions. She thinks she's going in and looking at the lesions that she is aware of. We have done repeat ultrasounds. My ovary is fine. There's not, especially my most recent one, there was nothing on it. So there's not like a regrowth that's identifiable there. But we did see that I was having more pain coming on again. I had pain in the spot. I didn't know that the rectal spot had been left. And I was having some pain. I was like, I'm weirdly having pain here. And when I reported that to her, she said, "Oh, I think I left a spot there." And sure enough, she did. So oddly enough, that helped me get out of my gaslighting place that I was in with myself, because I was like, do you know that that's there and that's why you think it hurts? Are you blaming this on the endometriosis when really it's something else? Is there something wrong with your liver? Even though your liver enzymes are completely normal and you've done like, they'd been elevated at one point. After surgery, they came down. Things got better, and then there was no evidence that there was something that would be going on with that. And like liver stuff doesn't normally hurt unless it's really severe liver disease, right? Like early stage of non-alcoholic fatty liver disease or even non-alcoholic hepatic steatosis, the NASH and NAFLD, those don't usually hurt. At most, they might feel fullness, but they don't hurt. And it was hurting, but I just was still in my brain. I was like, oh no, maybe it's something else. And it's finding ways it could be my fault instead of just being like, "Oh, you have that little spot on your diaphragm." But fortunately, labs were going back up and they were starting to look like they do, like they did for me with endometriosis. And fortunately, again, my doctor was really good at saying, "Yeah, it does sound like you're probably having a flare. I don't want to just let this slide. So here are options for what we could do." And options basically included repeat laparoscopy, hysterectomy, or a medication that would induce menopause. We chose the medication because it was the least invasive option. And during this time, by the way, I got high blood pressure out of nowhere. And it turns out that there's a really high correlation with endometriosis and high blood pressure. It's a correlation, not necessarily a causation, though, when you have inflammatory processes happening in your body, it can cause increases in blood pressure, right? So we have all this happen. I end up having like emergency levels of blood pressure, have to go get that addressed. And then anxious, like, all right, let's just get my uterus out. Like, let's just do this. The medication didn't really feel like it was helping. I wasn't making the progress. I was expecting it to just have no pain. was not like that. I had almost no response to the medication too. Like I was told I should expect headaches to get worse. My headaches got better. I was told to expect, because I'm a migraine person, I was getting like 8 to 9 migraines a month. And I went to none after I started a blood pressure medication and this medication meant to induce menopause. It's called Orlissa is the brand name. It's Alagalix is the generic. And so I started the medication and I was dealing with all this stuff. And then my neck stuff came up. And that's when we first, between when our first episode where we were live and our episode where was the first one we were on video with each other, I had the neck thing that we talked about. I think it was in episode 3 where we were going through all the stuff as I was dealing with that. And part of what I was dealing in that space was an endometriosis flare, blood pressure that just got really bad out of nowhere after never having a problem, no changes in my diet, no changes in my exercise, other than to maybe take it back a little bit, but still exercising a couple of hours a day between walking my dogs and Pilates and swimming and all the other stuff. So the increased inflammation and whatever role that played in my blood pressure going up, and then having the stuff with my neck that was degenerative and separate from the endometriosis, but having the overall inflammation that made it substantially worse or made it reach that threshold. Because, we can have degenerative changes. Like my spine isn't better. I still have the bone spurs in my spine. I still have the disc bulges in my spine, in my neck, and my low back for that matter. But they're not irritating me right now. And I'm not on medication for them because my inflammation was lower until recently because I was on this medication that it didn't necessarily help me feel a lot better, but it did lower my inflammation. We weren't sure if it was helping me or not. So we did a really good, thorough trial of going off the medication to see if it was helping more than I thought. Turns out it was. It was so maybe potentially progressing even with these 2 medications that are supposed to be suppressing or even regressing it. So my inflammation nearly doubled in 4 weeks off of the medication. And of course, my neck starts to get a little grumpy and other things start to get grumpier because the inflammation is going up and my sleep gets thrown off and my mood gets thrown off. And what else got thrown off in that process? I don't know.
Everything.
But we also figured out that because, with endometriosis, especially if it's reaching the point that it's problematic, like mine was, we don't have great solutions. So the reason we ended up finally landing on, okay, it's just time to have surgery is I tolerated medication that was basically trying to mimic surgery really well, with the exception that it gave me high cholesterol. So my choice was stay on this medication that, you can also only stay on for a maximum of 2 years and have your cholesterol increased. And you've got blood pressure you're well managed now, but having to still be managed. So let's increase your cardiovascular risk to avoid a surgery that, yes, there could be complications, but are you creating a whole other chronic condition or chronic problem by taking this medication that is also not completely resolving it? And by the way, because hormone replacement therapy, which my doctor just recently at our last visit shared with me, that there's not really great research about hormone replacement therapy and endometriosis. And so even though she said, I'm willing to bet that the hormone patch that's on your body right now is part of this, I would take it off if I were you. She said this to me in the emergency room and I took it off and never did anything with it again. She's like, there is actually no evidence whether it's going to make it worse or how it's going to impact endometriosis, probably because we're just not studying it, right?
Yeah. That's where evidence comes from, research.
And so why would you study this thing that you can't know that you have until you have a diagnosis? And we just expect women to have painful periods. And so we just accept it. And like the reality is, like I said, mine were not noticeably painful to me anyway. I don't know how much of that is me, how much of that is societal adaptation. I don't know how much of that is just my personal experience with my endometriosis. I don't know. But how we can go from something that we just normalize pain for women with their menstrual cycle and then don't have any way to diagnose a really more common than you think cause of significant pain during your period that can be really debilitating for a lot of people. So we finally reached the point for me that the bigger picture, that my inflammation is going up. My inflammation, that like there's a clear factor that we took this thing away, that it was meant to control endometriosis. And when this was removed, inflammation jumped quickly, that we need to get rid of the thing that's causing the inflammation, and how much more of an impact I will likely have on my overall pain, well-being, stability by removing the source of inflammation so that I can just move forward. Even though there are risks with any surgery, I feel like there's more risks with not treating it, because then I'm just going to wait and let things get worse. And what other problems am I going to cause for myself with having an unchecked source of inflammation, or taking this medication that could give me a significantly increased risk for cardiovascular disease? And I have cardiovascular disease in my family. So I said, I'm not willing to take it long term. I said, I'll take it short term before the surgery if it will help reduce the risk of the surgery. So that's what we're doing. Short term use of the medication to hopefully, at the very least, stop the growth, if not shrink the size of the lesions so that they're less risky to remove, and give me some relief, even if it's not complete relief in the meantime. And knowing that because my cholesterol, that it jacked up, went completely back to normal with just 4 weeks off of it. So that's where we landed. And long story complete, but for what it means to other people is, it's okay to fight for yourself. You might have endometriosis even if you think that you don't, because you don't think it's that painful. If you're having any sort of complications, and for me, I thought it was perimenopause. It was not perimenopause symptoms. They were all endometriosis symptoms, and those got managed. A lot of the things, not all of them, but most of the things that I was concerned about actually got better.
What a blessing that you have a physician that you trust, that you feel heard by, that you can collaborate with, and how important it always is to have a relationship like that with your provider. In menopause and perimenopause, it is, in my opinion, non-negotiable. And I'm so happy for you that you have that in her.
And also to your point, Jen, asking those questions. I don't know a lot about Orlissa, but the fact that you can only take it for 2 years. So then what happens after that 2 years when you can't take it anymore?
You have to have surgery,
Oh,
or you just
that's
have to deal with the
right.
pain.
So that's what I'm saying. It's not really a solution. It seems like a pre-surgical solution to get things under control for a more successful surgery, right? Like how we'll do like neoadjuvant chemo, right? Chemo before surgery to shrink a tumor so you have a better chance at removing it. But that's really seems like that's its usefulness and its
Mhm.
utility. It's not something that's going to change the condition necessarily.
And I won't lie, there's part of me that we did opt what we're going to do as a total hysterectomy. And I'm a bit nervous, but at the same time relieved. And ultimately, I have to accept that I'm not going to have any guarantees with anything. I don't know how I'm going to respond to it until I'm done. I hear so many people say that their lives are so much better after they have a hysterectomy, that I'm hopeful that that will be the case for me, and that there's all sorts of things that, because of my tendency to suppress, ignore, whatever, or just not be as aware of things because it has enough of a gradual build, that, for instance, when I went to see my primary care doctor just on Friday, after I saw my gynecologist, they do the intake questions, the vitals, what's your pain level? And I'm like, oh, it's the normal amount of pain. And I was like, and I realized pain should be 0. So let me tell you what my normal amount of pain actually is. And I'm so bad at pain because I am so chronically underreporting it. I have to pull up the pain chart in front of me to look at so I can accurately report what level of pain I have. Because I'm also learning that to get the support you need, you have to be accurately reporting those things. For instance, the stuff with my neck, in the pain clinic, if I wasn't at a certain level, I would not have gotten the treatment that I actually needed to get resolution, so that I didn't have to be on a medication with really bad side effects for the long haul. And so I guess my message to anybody who's listening is, if your periods are a problem, it's okay to ask for help. And like, we don't have to normalize that it's just we don't feel good for a week of every month. That if you're having perimenopause symptoms and they seem pretty profound compared to other people, maybe it's that, maybe it's endometriosis. And there's a lot of people who have endometriosis and have no symptoms for it too. So it's not a problem for everybody, that, it's found after the fact, or incidentally that it's found. But it's okay to ask for help. Be honest with yourself about the level of pain that you're actually having and not gaslighting yourself about it. And that there's some signs that you could lean into that might indicate something else going on with your body. And that it's just really, really frustrating that we have this thing that affects so many women. I'm not gonna like look it up right now and get myself super distracted, but it's a fairly large number of women who experience endometriosis, that this is the best that we have.
And if your doctor is telling you, oh, well, it's just normal female monthly pain, find
It's
another
not.
doctor. Keep looking until you find the doctor that listens and gets curious with you.
And I think that's really important for any body system, right? So endometriosis and menstrual pain is part of it, but I think Jen, you said was writing notes about things you were saying that I wanted to come back to, like normalizing pain in women in general, whether it's menstrual cycles or childbirth or joint pain or neck pain or frozen shoulder. That tends to be the case in general, I would say.
That we
And I
normalize
think
pain
that
in women.
absolutely. And then I think the medical profession and the medical system does it. And then we as patients, right? If we step out of our doctor shoes for a minute, like we as patients do that too. And I think most all of us that are probably 35 and older have also had an experience going in and being told, oh, you just need to lose weight.
Hmm.
And that has nothing to do with it, right? I mean, I think I was talking to you, Jen, with going in to see my rheumatologist for the first time. And my fear that her question to me would be, well, can you lose weight? And telling me that's what I needed to do. I remember having the discussion saying, but my pain is in my hands.
Hmm.
Right? It's not my knees and my ankles. My pain is in my hands. And that was like the only thing that gave me a little bit of confidence going in. Granted, I didn't end up needing it because she was a godsend and an
Yes.
amazing physician. But even having to think about that,
Hmm.
like that I need to justify my pain
Hmm.
to be able to get treatment for it. I think that's a big problem systemically.
The conditions that are the most prevalent for women tend to be things that are painful conditions that we don't understand where they come from. More women have migraines than men, and we don't understand where migraines come from. And they have so many factors that contribute to them. And for me, honestly, I mean, I had a migraine. It was a mild migraine compared to what I normally have, but I had a migraine when I came off of the Orlissa because guess what? It was probably, I mean, hormones definitely have impacted my migraines. Blood pressure probably impacted my migraines. How are all of these things intertwined? We'll find out eventually. So maybe we'll have an update and I'll let you guys know if my blood pressure tanks after I have my surgery and I have to get off of my blood pressure medications. Um, and if all of a sudden my knee pain and neck pain and everything are just good to go, easy peasy. And I suspect that it won't be completely resolved because I mean, I'm getting older. I have some osteoarthritis and I've not always been gentle with my body. And even knowing or suspecting that it's not going to completely go away, I do think it's going to be a lot better. I think I'm gonna be surprised at the ways that I feel better that I'm just getting used to and that I've just accepted that this is just how I feel. I'm hopeful that when we are chatting in mid to late April and definitely into the summer, that I'm just like, guys, I had no idea.
Yeah.
And here are all the things.
And I think that happens a lot with blood pressure specifically. Like, I expect your blood pressure to probably go down to normal because how much does pain and the stress of the pain and the stress of the not knowing drive that blood pressure up?
And just all
Hugely.
of the inflammatory
Right.
cytokines swirling around my body
And
because
blood
it's going,
sugar,
yeah.
right? Like,
My
what's
blood
the
sugar's
number
even
one
been
thing that
fine, but yeah, all of the things
yeah.
that are fine, but that I've been worried about and like even beating myself up about saying, "What am I doing wrong? What do I need to do better? What do I need to do differently?" And how much of it is connected to something that I had no control over and like no way I could have influenced it and that we just don't understand as well as we should.
And how many of those things are driven by stress?
Mhm.
That's such a big challenge too.
Yeah, I mean, the part of the story that I left out is that after my first hospitalization, when I got diagnosed with the endometriosis, 6 days later, I ended up back in the hospital for another 8 days because of intense neck pain that sent me back to the hospital again a year later. When I was in the emergency room the second time, I was like, this is my third emergency room visit in like 2 months. Clearly, I was in the emergency room telling myself that I was the cause of the problem, that my life was killing me, my life was hurting me, and I needed to make changes so that I wasn't continuing to go to the emergency room. And I think that there's some truth to it. And I did need to make some changes to help reduce things overall. And I still put too much on myself for things that I didn't have any control over.
Where the medical system failed.
Yeah.
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 And what message does, we're seeing these studies of women waiting 15 to 30 minutes longer than men to receive pain medication. What message does that give women when they're sitting there tolerating that pain, thinking there's something wrong with me? But
Hmm.
it's the medical world that needs to be identifying what is happening and also not gaslighting women into, oh, you can handle that. But if you're a man, you get your pain medication right away because we're going to take what you have to say seriously.
Well, and we could also talk about the fact that there's, especially in the pregnancy and birth realm, that there's such a push to have natural birth without medications that I bought into, that I was so worried about what was going to happen to my kid if I gave myself any relief in the process of bringing her to life and bringing her into the world, that set me up in some ways to just get to the point that I had to be taken away in an ambulance before I even gave it any attention, you know? And if you don't suffer through this really painful situation, if you don't just accept this amount of suffering, this is what's going to happen to your child. When the reality is, I mean, yes, there is some correlation with some medications in susceptible individuals to having complications for the child post delivery, but it's not that. I don't think it's as many as that is offered to
And the
women.
thing that is completely missing, and I live this myself, is how the mother's well being impacts the child's health.
Mhm.
When I am led to believe that the healthiest thing for my child is to endure more pain, and I'm not just talking about the not unmedicated labor that I had, I'm talking about the pain after, of everything related to keeping a
Breastfeeding.
child alive, yes, and other things. When I endure more pain, I was taught or made to believe that my child was going to be healthier. And the moment that I finally faced that
Such bullshit.
illusion, it was totally false. And the moment that I had the courage to say, wait a minute, something's not okay here, and took a completely different turn in how I managed my own health, my baby was happier and was sleeping longer because my nervous system
Yeah.
was finally at ease. And so it's so backwards, right? Like that's not the relationship and the nervous system coupling that happens between a mother and an infant and child later on, but certainly in the fourth trimester is not something that's really studied. And so they're putting all of this responsibility on mothers and these tangible medications and procedures and all of that. But happy mama, happy baby. It really is that needs more attention.
Just to wrap today, I hope that my sharing my story helps somebody maybe catch endometriosis for themselves a little earlier than I did, or avoid some of the complications that I had. If you are not tolerating hormone replacement therapy, well, perhaps that's something to look at. If there's a family history, maybe consider that before you start hormone replacement therapy, and recognize, like, I'm probably going to be able to get hormone replacement therapy after I have this surgery, because then it's not going to be a problem. So am I going to actually just do better overall as well? So
Jen, I literally have that written down because that's what I was thinking.
yeah, yeah, all of the ways that this might actually help me in the long run. And I'm glad that I didn't stand in my own way. I'm glad that we were thoughtful about it, because it's not a nothing surgery. And I hope that it comes through with no complications or any issues. But let's just do better. Let's all just do better for ourselves, for our sisters, for our mothers, for our daughters. Let's just do better for women in healthcare, and recognize that women feeling good is good for everybody.
Yes, that's it. Yes. And don't stop until you find someone who listens, because having a team is really powerful.
Yeah. All right, ladies, let's wrap there for today. All right. Love you guys.
Love
Love you
you.
too. Bye.
Bye. If our messy is your kind of messy, we'd love for you to rate, review, and follow or subscribe wherever you get your podcasts.
We'd also love to know what's on your mind. If you were to join us, what would we be talking about? Email us at messymidlifepodcast@gmail.com or message us on Instagram or TikTok.